62-year-old Nigerian national, Mrs. Shaubola, presented to me 6 months back with complaints of severe incapacitating low back pain with radiation of pain to both the lower limbs of nearly 4 years duration. We did investigate her at that time and found out that she was suffering from degenerative lumbar scoliosis as well as spondylolisthesis at L4-5. On MRI, she was found to have multi-level canal stenosis and advised surgery, but because of her being accompanying her mother, she had to go back and then come back at a later date for surgery.
My name is Shaubola and I come from Nigeria. I live in Lagos. I came to know about the Manipal hospital when I came with my mother in October. She had a health issue and I decided to take the All Wealth scheme, health scheme. And it was after that scheme that I mentioned that my back was giving me challenges and they referred me to the spine department. When I met by Dr. Vidal, he said I should go and do an MRI and an X-ray. And the result came back as a shock to me. I've been having challenges with my back in the last 7-8 years, but I didn't know the extent of how bad they have really gone. So the MRI revealed a degenerating back, and that if I keep walking about without doing something about it, it will either be stuck at a particular area, or I would be paralyzed in one area because there wouldn't be enough movement. So it was a rude shock to my system, and he said, I need immediate operation. But I couldn't because of what I came to do. I had to take my mother back and all that. But I said I'll be back in the new year. So I came back in March for the operation of my lower back. And from the moment I came into the hospital, from the international section, headed by Peter and all the team, we had the best service you could ever have. They were very courteous, they were very supportive, they were very caring.
So she came to us now, all mentally prepared for surgery, and these were her recent X-rays that we took. Her lumbar spine was bent to the right, which we call in medical terms as scoliosis, of around 28 degrees. And if you see the lateral views, there is a slip of the bone L4 over L5. This is the whole spine standing radiographs of hers, showing the exact measurement of the angle. And this is the MRI, which shows multi-level spinal compression at L23, L34, L45 and L5S1. So our plan was posterior spinal instrumented scoliosis correction and posterolateral fusion from T11 to S1, as well as posterior lumbar interval fusion at L45 and L5S1.
So I went into theatre in the confident hand of Dr. Vidal. And I came back, and immediately I came around. I was taken, to my shock, to the X-ray department, and I thought, am I going to rise up from this bed or whatever? But the state of the art equipment meant no pain, no movement, and it showed me the X-ray of my new back, and it was also a new awareness that I have a total new back, and I'm renewed and restored. So I thank God for him. And then from the moment we got back into the hospital with care and the physio, despite the physical pain, we've had excellent executive support. The nurses, the nursing sisters, the nurses in the ward, everybody, the customer service, the nurses that visited us all day. We were put in the hands of a wonderful young man called Abraham Shalom, the physiotherapist that did his best, and he was always very careful and very cautious, and he knows what he's doing. And the reassurance from Dr. Vida that everything will be okay, you have no, say go home, everything is okay. And it's just been like that. I want to speak especially about the Manipal Hospital and their services. There is none of it in the world. The staff are trained. They have the heart of love. Because in any operation, because I used to work for and care for people. I know that what is important is the aftercare, and they gave that. The homes we are living in, which is just next to the hospital, they are very kind, very loving. The spine department is a special department that, welcomes you with a smile. And the doctor in charge of the spine is just, if I may call him, a whiz kid. He knows everything about what he's doing. He's caring, he's supportive, he's loving. I could only pray that God will continue to support him and give him more knowledge.
Upon having her consent, we undertook this major surgical adventure, lasting for about 6 hours successfully, with loss of 800 cc of blood and patient walking after 4 hours of surgery. She was discharged from the hospital after 2 days of surgery, and this is her post-op X-ray. If you see, the scoliosis has been nearly fully corrected and she has restored her good sagittal and coronal balance. End of it, she is happy and we are happy too.
Say that is the best. I would recommend Manipal to anybody all over the world that I know, because of your service and because of the staff.